Hi, everyone. It's Dr. Erin Stubblefield again from the KMC University Help Desk, talking today about fraud, waste, and abuse. We got a question in the Help Desk that was asking how the most recent code updates in October of this year, how they could put their practice at risk for fraud, waste, and abuse. And it's a great question and something that a lot of chiropractors may not fully understand. So we're going to start by defining fraud and abuse, and then look at some ways that you can safeguard from this in your practice. So fraud is considered an intentional act of deception for financial gain. So an example of this is knowingly billing for services that were not performed or consistently upcoding for a higher paying service. An example of this might be billing for a 99203 when you haven't met the time component or the medical decision-making component to bill for that level of E&M coding. And then abuse is defined as improper practices that result in unnecessary costs to the healthcare system, even without, and this is the important piece, even without malicious intent. So again, a simple coding error or a billing error for billing for a service that's not medically necessary. Even if it's not done maliciously, it still falls under that category of abuse. And why would new codes, for example, the new ICD code changes that come out every October, why might that increase our risk? Well, every time there's new or updated diagnosis codes, it creates a heightened period or risk of fraud, waste, and abuse. And here's the three primary reasons why. The first is confusion and unintentional errors. So with hundreds of updates, because it's a pretty big list of codes, right? Simple mistakes are more likely. So we're not updating our codes in our EHR. We're not training our staff that there's new codes that have been updated, and we're not training our billing people to look for these new codes. So if there's a consistent pattern of unintentional errors, again, even if they're unintentional, it can be flagged as. And then we have what's called the hiding in plain sight problem. New codes can make it harder for payers' automated fraud detection system to recognize unusual billing behaviors. And even if the problem is on the payer, we can still be held responsible because we should also be making sure that we're billing the most appropriate code, especially around this time of year when the codes change. And then the third is lack of specificity. New codes demand a higher level of detail in our documentation. So if documentation doesn't support the billed code, it could be interpreted as what's called a misrepresentation. And all of these can add to increased risk of fraud, waste, and abuse. So let's look at some common pitfalls that might attract an audit, right? The first is billing for unnecessary services. And this is particularly important when we look at Medicare, because if we're billing for maintenance care or treatment plans that don't have a clear end date, right, all of those things can be a little sketchy. And Medicare specifically only covers active treatment for one of three subluxation codes. So again, making sure that we're not billing for services that are not covered. Then we've got improper use of modifiers. So again, if we're incorrectly using the AT modifier, that would be a red flag that might get an auditor knocking. And then something like a routine waiver of copay. Again, regularly waiving copays and deductibles can be seen as inducement and therefore a form of fraud. So what can you do to safeguard your practice? Well, there's two things that we highly recommend here at KMC University. The first is proactive education. So commit to educating your entire team from front office to billing and everywhere in between that those new codes are coming in and that specific documentation may need to change to best suit the new codes and the requirement of those new codes. And then to refine our documentation. Notes must be detailed and tell a full and complete story. This effectively justifies medical necessity for every service that we render to our patients and therefore bill out. So those two things, educating and documenting, are going to be really what helps us during this transition of new codes to prevent fraud, waste, and abuse in our offices. If you like this content, please follow KMC University on all of our social media platforms for more tips and tricks from your chiropractic, compliance, and reimbursement experts.